Hello, everyone. I am Dr. Caio Figueiredo. Welcome to Bovineology. Hello. Welcome to our second video. So last week, we talked about a variety of topics associated with metritis. For instance, we talked about how metritis changes the economics of a herd and how metritis is associated with impacts on welfare. This week, we're going to talk about how metritis changes fertility outcomes. So last week, we talked about diagnosis of metritis, and I want to pick on this topic to start this week. So as I said last week, it's common practice to diagnose metritis through the visual evaluation of the vaginal discharge. Multiple herds use rectal palpation and retraction of the uterus to recover vaginal discharge from the vagina. So here, I want to show you an alternative that does not require us to rectally palpate the animal and retraction of the uterus. So this is a tool that consists of a metal bar with a handle, and it has a rubber cup at the end. This rubber cup is flexible, and it helps us to avoid injury to the cow while we are performing the examination. So basically, we're going to disinfect this tool, introduce into the vagina, and then retrieve the vaginal discharge into the outside so we can visually evaluate it. So as I said, metritis happens from the 1st to the 21st days after calving. If you are from a farm, if you're going to the farm or help a farm into developing protocols, health checks to evaluate cows for postpartum uterine diseases, and you cannot evaluate these cows every day, you should be able to select a couple of days. How can you do that? So this is a study published in 2018 by Galvão. And again, we see on the x-axis days postpartum. It ranges from 1 to 21, as I mentioned. And on the y-axis is frequency. What is that? Is the days that metritis is more commonly observed. And we see that between days 4 and 9 is when metritis is more commonly diagnosed. So if you want to develop a protocol where you're going to restrict days that you're going to evaluate cows, you should restrict to one of these days, or at least 2 or 3 of these days, so you're more successful when diagnosing cows with metritis. All right, after I diagnose, what do I do? Well, it's a disease, it's a bacterial infection, you treat. So in the United States, the antibiotic that is labeled for the treatment of metritis is ceftiofur. There are 2 formulations available for ceftiofur hydrochloride, ceftiofur crystalline-free acid. So here, I want to show you the efficacy of the treatment of ceftiofur compared with animals with metritis that were not treated. So here on the x-axis, we have different formulations of ceftiofur, and on the y-axis, we have proportion of cure. What is proportion of cure? Well, these studies, they diagnose cows with metritis based on the visual evaluation of the vaginal discharge. Again, the vaginal discharge that characterizes metritis is watery, fetid, and reddish and brownish. So day 0, they diagnose cows with metritis, and then they treat it. One group of animals were treated, another group of animals with metritis were not treated. And that's how they were able to evaluate the efficacy of the treatment of metritis. And then by day 10 of the study, between day 10, 14 of the study, 12, they reevaluated for clinical cure. What did they do? They did the visual evaluation of the vaginal discharge. Animals with metritis that still displayed a vaginal discharge 5 were deemed not clinically cured. Animals with vaginal discharge of a score 4 or less were deemed cured. And that's what this proportion represents. So all the gray bars represent animals with metritis that were cured, and all the black bars represent the group of animals with metritis that were not cured. And then we see that if we apply any treatment, we bump up the proportion of animals that achieve clinical cure. So we get some points from this. So the first point we get is that metritis is a disease that has a high proportion of self-cure. What do I mean with that? You don't treat, and still animals reach clinical cure at a high proportion. The second message that we get from here is, all right, everybody's talking about efficacy on treatment, but what happens to the animals that do not cure? Does fertility change for animals that do not cure, survivability, milk production, so on and so forth? So up until now, we didn't know that. Now, there's a study that is under review at the Journal of Dairy Science in 2020 that separated animals with metritis that achieve clinical cure and animals without metritis that did not achieve clinical cure. And I'm going to show you the fertility outcomes associated with three groups: animals with metritis that cured, animals with metritis that did not cure, and for the reference, animals without metritis. So this is a paper of mine. It's under review at the Journal of Dairy Science. And I measured a couple of factors. One is uterine health, and I measured through the incidence of purulent vaginal, the prevalence of purulent vaginal discharge, and proportion of cytological endometritis. I also measure resumption of estrous cyclicity, pregnancy per artificial insemination in the first service, and pregnancy loss. So we see that the light gray bars represent animals without metritis, no MET. The mid-gray represents animals with metritis that achieved clinical cure at day 10 of the study, MTC. And finally, the black bars represent animals with metritis that did not achieve clinical cure at day 10, black bars. And we see that there is an effect of metritis on the percentage, the risk of purulent vaginal discharge, as both groups have more proportions of purulent vaginal discharge compared to animals that did not have metritis. But we see that this effect is aggravated for animals that do not achieve clinical cure. Likewise, for cytological endometritis, we see similar patterns. Animals with metritis, both groups, have greater proportions of cytological endometritis at day 35 in milk, and we see that this effect is aggravated for animals with metritis that do not achieve clinical cure. For resumption of estrous cyclicity at day 60 in milk, we saw an effect of metritis. However, this effect came solely from the animals with metritis that did not achieve clinical cure, as these animals had reduced risk of resuming estrous cyclicity compared to animals with metritis that achieve clinical cure and animals without metritis. For pregnancy per artificial insemination in the first service, we did not find a statistical difference, just a numerical difference. It's important to mention that pregnancy per artificial insemination was calculated as the number of animals that were pregnant at reconfirmation, and this was 60 days after insemination, divided by the total number of animals that received artificial insemination in that first service. So we see that although animals with metritis have reduced pregnancy per artificial insemination, and this difference is just numerical, we did not find a statistical difference. There are other studies that compared animals without metritis and animals with metritis, and they found a statistical difference. For example, there is a study from University of Florida, Dr. José Santos, published in 2010. They found a statistical difference. 2013, another study from University of Florida, Ribeiro et al., they found statistical difference in pregnancy per artificial insemination in the first service. Now, when I divided by animals that achieved clinical cure and animals that did not, I didn't find a statistical difference. Finally, in pregnancy loss, I found a tendency for the effect of cure as animals with metritis that did not achieve clinical cure tended to have greater proportions of pregnancy loss. In addition to all these measurements, I also calculated the average time to pregnancy within 300 days of milk. And having animals without metritis as a reference, animals with metritis that achieve clinical cure at day 10 take an additional 18 days to get pregnant, while animals with metritis that do not achieve clinical cure take an additional 30 days to get pregnant. When this study comes out, you're also going to be able to find data regarding survivability and milk production as it changes according to clinical cure. But what I wanted to say is that, again, metritis is a very costly disease. Metritis has huge production impacts and also impacts on fertility. And animals that do not achieve clinical cure have even worsened fertility outcomes. Thank you for watching. Please subscribe and share the video if you like. And next week, we're going to talk about other postpartum uterine diseases. Thank you for watching. See you in the next video.